Hi guys, how are you doing? I hope you're all well. I'm good. This is Racheal Kangethe. Welcome to my channel. In case it's your first time here, welcome and subscribe. And in case you're a regular here, welcome back. In this video, we are going to do a breast cancer examination at home. October is a breast cancer awareness month, and for that reason, there is no way this month is going to end without us doing an examination at home, without you visiting the doctor, meaning that this is cheap and it can save a life out there. Remember, breast cancer is one of the most prevalent cancers in the world, and actually it gets men and women, but mostly women are the ones that it affects. And as long as you are above puberty, you can get breast cancer, but mainly the risk increases with the age. So people above the age of 40, they are actually at a higher risk of suffering from breast cancer. So guys, and this one is for us. Share with girls, share with ladies, share with the sisters, brothers, anyone, because this one can be life-saving. So we are going to start, and we are going to start with visually examining our breasts. First, you're supposed to stand in front of a mirror without your blouse, without your bra, just you without any clothing on top. So we are going to stand in front of a mirror, and you're supposed to visually examine your breasts. Normally, you know how your breasts look like, the texture, the size, all that. So we are going to look out for several symptoms. One, you're supposed to have your hands on your waist. Then look at the mirror. Make sure that your shoulders are level. So look at the mirror and then look at your breasts. You're supposed to watch out for these symptoms. Check for change in size and texture. Mainly and mostly, sometimes you might realize that your breast, one is bigger than the other. That is common, but it should be slight difference, not significant difference. Just like your feet, sometimes you might find that one of your foot is bigger, slightly bigger than the other, but that doesn't mean that unaweza vaa kiatu size moja, mguu moja size 37, hiyo ingine size 38. It's just slight difference. So it is common, but if you notice a significant change in the size of your breast or texture, then that is one of the symptoms. The other one is swelling. In case your breast is swollen, one of them is swollen. The other symptoms that you are going to watch out for is redness. Can you see some redness on your breast? The other one is dimpling. A part of your breast that is somehow ni kama dimples inaingia ndani, ishaingia ndani, and you can actually notice that from looking at your breast without touching it. Yes, so that is another symptom. The other one is nipple retraction or inversion. Normally, a nipple points outward, but in case you notice that one of your breasts has a nipple inverted, iko ndani, or it's retracting, inaingia ndani, it's a sign to watch out for. And in case it is something that is prolonged, if you notice that same change today, tomorrow, the other day, like it's not changing, then it could be a symptom of breast cancer. The other one is nipple discharge. Is there any fluid coming out of your breast? And this one, I have to say that you're supposed to do this examination when you are not on your periods, when you are not pregnant, and when you're not breastfeeding. So as a matter of fact, you're supposed to do this examination a day or two after your menses. This is because mainly sometimes our breasts are tender, and this causes pain when you apply pressure or exert pressure on them. So you are supposed to do this 1 or 2 days after menses, because your breasts are less tender or less painful after your menses. So guys, we are going to go right into now examining our breasts physically. After visually examining your breasts, we are going to do now the physical one using your hand to feel for lumps and other things that I will tell you. So hold your arms on your waist. Remember I told you can do this lying down or standing up. Stand up straight. You can first have your arms up, then have your arms akimbo. Then make sure that your shoulders are level. And then you are going to use your right hand to examine your left breast. And you're going to use your left hand to examine your right breast. So, guys, have your arms akimbo. Then stand straight. Have your one of your hands on at the back of your hand. And then we are going to use these 3 fingers. The ring finger, the middle finger, and the index finger. You are going to use this part here, to feel for lumps and bumps. So have your fingers close to each other like this. So have one hand at the back of your head, and then have the other one stand straight and start from your collarbone. Exert medium pressure firmly without releasing. So down towards the ribs. And you're going to have circular motion, like you're massaging your breast without releasing the pressure. You're going to have circular motion from the collarbone towards the ribs. And you're going to just exert pressure firmly. And then at the bottom of your breast, then start going up from the inside of your breast, in between your breast. And you're supposed to feel the entire breast. Have those circular motions until you get to the nipple. Then when you get to the nipple, you're supposed to press the nipple. First to see if there is discharge, and secondly to feel if there is any pain. So as you watch out for lumps and bumps, hard lumps and bumps, you're also supposed to feel if there is any pain in your breast. So do the same for the other one. Still raising your hand at the back of your head and using the other arm at the other hand, and use this part. So you are going again to start from the collarbone towards the ribs and have circular motion. Exert medium pressure firmly all around your breast and back to the nipple. And then guys, you're supposed to examine the under your arm. You're supposed to feel for glands. Are there glands that are swollen? Can you feel some pain under your arms? That's what you're supposed to watch out for. And then you are also supposed to check your lymph nodes. Are they swollen? Are they painful? So guys, that is how you examine your breasts while at home. This one can save a life. Remember guys, early detection of breast cancer will save your life because it leads to successful treatment most of the times. So the risk factors of breast cancer. 1, if you are a woman, you are at high risk than men. It is most prevalent in women than in men. So that is 1. If you are a woman, that is a risk factor already. Then there is age. People above the age of 40 years and above, 55 years and above, you are highly likely to develop breast cancer as opposed to somebody in their early 20s, in their teenage. As long as you are over puberty, you are also at risk of having breast cancer, but the risk increases with age. The other one is regular and prolonged consumption of alcohol. So if you take alcohol regularly, as a woman, as a man, you are at a risk of developing breast cancer. The other one is smoking. If you are a smoker, you also are at a high risk of suffering or developing breast cancer. The other one is inactivity. You need to keep active. And the other one is obesity. In case you are obese, you are also at high risk of developing breast cancer. The other one is the age at which you have your first child. the age at which you breastfeed first. So that one is also, in case you do it later in life, you are at high risk of developing breast cancer. Another risk factor is family history. In case you have somebody close to you, like a mom, a sister, somebody close to you who has had breast cancer before, you are also at a higher risk of developing the same condition. So keep checking, guys. Keep examining yourselves at home. This one will not cost you much. It is less than 5 minutes and you will be good. It can save your life. So remember, guys, in case you find a lump or a hard bump, it does not mean you have breast cancer. You need to visit the hospital, talk to your doctor. They will examine you and clarify in case there is need for further action. So you might find a bump, a lump that is benign. That means it is not cancerous. Or you might find a lump that is malignant, and that means action needs to be taken soonest possible. But you cannot tell this without visiting your doctor. So in case you find something, make a point to show up to the doctor's office soonest possible, and don't puuza. Usipuuze. Don't puuza. Hata kama you feel like it's something unusual, a pimple or something, just show up. To contact your doctor and they will clarify. From that, they will take care of you. So guys, this is the end of this video. Remember to do a breast cancer examination at home every month after your menses, and this can save lives. So this is it for this video. Remember that this life is mainly about progress, not necessarily perfection. And until next time, guys, bye.